Good morning, everybody. My name is Baoru and I represent the Food Chemistry and Food Development Group at the University of Turku. Maybe a few words about our research related to berries. So our Food Chemistry and Food Development Group has been researching, studying the composition of Finnish forest berries and also cultivated berries, and how different components of the berries would influence the sensory properties of the berries and the health benefits of the berries. Also, we have been very much investigating how different northern climate parameters will influence the quality, composition, maybe hopefully also the health benefits of the berries. Also, in addition to this chemistry approach, we also continuously carry out clinical research, clinical human intervention research on the possible health benefits of the berries. Of course, most of this research we have to do in collaboration with our colleagues at the medical school and our colleagues in the other universities in Finland. Think about the chronic health problems in the modern society. We have, of course, many different kind of problems, but if you look at the most general, most important ones, for example, we have very commonly seen that allergy, different types of allergies, allergies to the environment, allergies to food, and these allergies are mostly related to some abnormal immune reactions. So sometimes the immune systems seem to be too sensitive that this will cause common allergy problems. And another health risk is the cardiovascular health, the health problem related to the cardiovascular systems, and then the obesity, metabolic syndrome, and diabetes is a common health risk nowadays. And in the end, the society is aging, and the modern lifestyle causes us all the time different kind of stresses. So this is also a significant issue to be addressed. Think about the health benefits of berries related to allergy. We have actually lots of research related to this. The common background related to atopy, related to diet and metabolism. So fatty acid composition in the diet seem to be an important issue. So we have omega-3, omega-6 balance. If it's not very well balanced, then we would have a kind of increased risk of atopic allergic reaction, and also how the metabolism will go in the body. So the Finnish berries seem to have a beneficial oil, fatty acid composition in oil. So the berries have seeds, and seed oil have a very good balance between omega-3 and omega-6 in the fatty acid composition. So here we have research shown that, for example, blackcurrant seed oil, musta herukka-siemenöljy, if given to pregnant mothers during the pregnancy, also during the breastfeeding, this could reduce the risk of babies, the newborns, in developing atopic eczema. Also, sea buckthorn oil supplementation, eating a few grams of sea buckthorn oil for a few months could reduce the symptoms of atopic skin in adults. And lately we have research showing that only 2 grams of sea buckthorn oil supplementation for a period of 3 months could reduce the dry eye symptoms. Dry eye symptoms seem to be a common problem in winter time. So for many people, especially people with a tendency of high sensitivity. And related to atopic and inflammation, so we have quite a few research showing that berries could really reduce the CRP value. CRP is commonly seen as an indicator of common inflammation. So berries could have some role to reduce the tendency of inflammation. So this is an example showing that already quite old research. We've seen that by eating sea buckthorn seed oil, you could modify the plasma fatty acid composition towards a so-called more healthy direction. So the fatty acids in the sea buckthorn seed oil could be incorporated into the plasma, and this incorporation is positively correlated with the symptom improvement. And I'm sure Raija will talk about this research. This research is actually led by Professor Raija Tappunen. So this is the example showing that eating blackcurrant seed oil during the pregnancy by the mothers and also during the breastfeeding, one could reduce the risk of the babies in developing atopic skin. Related to cardiovascular health, so researchers have shown that berries and berry products could improve plasma lipid profile, could inhibit plasma lipid oxidation, could reduce platelet aggregation, and also inflammation. Reducing inflammation is a positive indication in reducing the risk factors of cardiovascular disease. So here we have, again, blackcurrant seed oil studied, sea buckthorn oil studied, and then sea buckthorn oil in reducing plasma, especially LDL cholesterol levels. And here also some research carried out by researchers from University of Eastern Finland have shown that whole grain product, bilberries and fish oil in combination could improve the plasma lipid profile. For example, shift the HDL into the direction of larger particles, also reduce the inflammation indicator in people with a higher risk of obesity and metabolic syndrome. So this is an example showing that platelet aggregation was reduced by sea buckthorn berry oil supplementation. So both the total aggregation and the speed of aggregation are reduced. We're talking about healthy subjects in this case. And it's difficult to, of course, to separate clearly the risk factors from cardiovascular disease and the risk factors of diabetes and metabolic syndrome, because they are always going hand in hand. But anyway, so if you look at some of the researches that have shown that berry products and berry fractions could influence some of these markers in diabetes and metabolic syndrome. So for example, the Finnish berry products mostly are products from bilberry, lingonberry, blackcurrant and sea buckthorn. And together, this kind of berry diet reduced the liver alert values compared to the common advice of a good lifestyle. So this is something very positive in terms of the possible risk of metabolic syndrome, because alert value is generally taken as an indicator related to metabolic syndrome. And also sea buckthorn berries and the ethanol extracts of sea buckthorn berry have been shown that eating this berry could reduce the insulin response after an oral glucose dose. And the same finding have been shown in lingonberry, also eating dried lingonberry together with the oral glucose. So this lingonberry could reduce the insulin peaking after the oral glucose dosage. And what is actually quite interesting is that, so this is actually the example of different berry products that has been studied in clinical trial. So we have berry powders from lingonberry, bilberry, sea buckthorn, and currants. We have different berry seed oils. We have different dried berries and bread with lingonberry and berry juices and frozen berry. So this kind of mixed berry product diet showed reduction in, look at the pictures, in most of the individuals the ALAT values are reduced. And here an example showing that sea buckthorn berry, the up is the line, you show that without any supplementation the glucose will pick up, but with dried sea buckthorn berry or with the phenolic fraction of the berry, so you would reduce the insulin peaking after the oral glucose dose. And here's the same kind of picture achieved by lingonberry. So if you add lingonberry together with oral glucose, you will see the peaking of insulin is reduced. So also one interesting research which we have lately published in American Journal of Clinical Nutrition is that so sea buckthorn berries and blueberries have positive effects on indicators of metabolic syndrome, plasma lipid levels, and the most interesting thing is that the effects would depend on the baseline levels. So if you are already a healthy person without the common plasma lipid profile, the effects is less significant compared to the situation if the starting point you have already more so-called bad lipid plasma lipid profile. So if your lipid profile is more already towards the direction of metabolic syndrome, you will get more benefit by eating the berries. So this is a very interesting finding as such. And the last thing actually I like to talk is that the berries in correlation with reducing the stress and aging. There are lots of such research done, for example, many in vitro studies showing the antioxidative properties of berries and berry fractions. And here shows that some of our own research, the left side we see that the berries, sea buckthorn berry oil and seed oil could reduce the DNA oxidation in vitro. And then the right hand side we show that the different berry seed oils have good capacity in scavenging peroxide radicals. So the so-called ORAC value is a general indicator about the antioxidative activity of different compounds. And then we see that the content of tocopherols, tocotrienols in the berry seed oil is positively correlated with the antioxidant activity. So the antioxidants in the berry seed oils are significant. And also some of the studies have shown that blueberry anthocyanins could indeed reduce the DNA oxidation in vivo. Also increase the expression of some antioxidative enzymes in vivo. So these are just some examples showing that berries have great potential in reducing the damage caused by stress and in reducing the changes caused by aging. So in the end, we have quickly listed some of the research, actually most of the research I have mentioned here is done by our group together with our partners, and also I have taken some of the research done by other Finnish colleagues here, but this is not at all an extensive list of the research currently available showing the health benefits of berries. But anyway, it's a good and close example showing that what the Finnish forest and wild berries can do in terms of management of health problems in the modern society. But anyhow, in conclusion, the diet rich in berries and berry products have potential in risk reduction and management of the common chronic diseases in the modern society. But also good to remember that berries and berry products are such, they are not drugs, they are food. So most of the health effects we have seen in the clinical study, even though the p-values are smaller than 0.05, they anyway are quite moderate effects. So in some of the studies you often see contradictory results. In this study it's positive, that another study could be no effects or negative. So in the end, the long-term dietary supplementation or dietary intake, and together with healthy lifestyle, is important to reach significant health benefits. Then of course, in terms of product development, we have all kinds of challenges as we have raised so far during the day. But I think that the guys also have a very good strategy in trying to push us into the direction of innovation. So it's sometimes, I have to say, a little bit stressful when you apply funding. You think about what would be the interest of research and what then the guys would say that, okay, you need to think about the innovation and the business. But I think that we are anyway going to the right direction, and it's not easy, but I think we have good opportunities. Thank you.